Welcome, everyone. We are live with another episode of Level Up Law, where every Tuesday at noon, South Carolina Legal Services levels up your legal knowledge about an area of law that we practice in. I'm Senior Staff Attorney Susan Ingalls here with our producer, Kenneth Elliott. We're in the background, and you are viewing Crystal Strong with the South Carolina Department on Aging. Crystal is the Program Manager for the South Carolina State Health Insurance Program and the Senior Medical Patrol Program. So we are observing Older Americans Month in May, and what better way than to explore some of the services that the Department on Aging here in South Carolina provides. Today, Crystal will be discussing the two programs that she runs and how the department helps seniors, especially in particular through the SHIP program she will be talking today. But before we get started, we do want you to know this is not legal advice. It's just general information for you, the public. If you need the help of a lawyer, call our intake line here at South Carolina Legal Services or apply online. That information will be provided at the end of today's presentation. And of course, Crystal will be providing to you the contact information for the State Health Insurance Program as well, where if you have issues with your health insurance, particularly Medicare, she is there to help you out. Also, as a reminder, before we get started, all of our episodes are posted by our wonderful producer, Kenneth Elliott, to the Level Up Law playlist on our YouTube channel, usually within about 24 hours. Now, our presenter today can answer some general questions if she does have time at the conclusion. So if you do have questions for Crystal, just put them in the question box on your screen, and we will be, as I said, posting this on our YouTube channel as well. Be sure to check out our social media, and particularly that YouTube channel. Like, subscribe, sign up for those notifications so you'll get up-to-date information from us, and also you'll be notified anytime we post a new episode of the show. And again, those websites, social media handles, all of our contact information will be provided at the end of this presentation. So without further ado, I'm going to turn the program over to Crystal Strong. Welcome, Crystal.
Thank you, Susan. Good afternoon, everyone. I'm going to go ahead and get started with our program. I'd like to say thank you for having us here so that we're able to talk about SHIP and what it is. Okay, go ahead with my presentation. Well, I had it really going a second ago. Okay. All right. We see my screen? All right. What is SHIP? SHIP is the State Health Insurance Assistance Program.
Crystal, we don't see your screen right now.
Okay.
All right.
Can we see it now?
I don't see it. Kenneth? Producer Kenneth?
I don't see it. Let me grab controls and I'll hand it back to you.
Okay. I think when I took my screen down, I erased it. Okay. All right. Show my screen. Are we seeing it now? There we go. Okay.
Yeah. Now just, if you want to, there we go.
All right. Are we there now?
Yeah, we're back to the Level Up Law screen.
All right. Thank you.
There we go.
There we go. Who technology works only when the user is correct. Thank you. So what is SHIP? SHIP is the State Health Insurance Assistance Program, and basically we are all things Medicare. So I'm just going to go do an overview of what SHIP is and how we actually operate in the state of South Carolina. As I mentioned, SHIP is the State Health Insurance Assistance Program. It's a statewide health insurance counseling service for Medicare beneficiaries and their caregivers. SHIP is counselor and volunteer-driven program that assists consumers in making informed health insurance decisions. There is a SHIP program in every one of our states, including our territories. In South Carolina, currently we are known as iCare, which stands for Insurance Counseling Assistance Referrals for Elders. Every state has probably a different name, but we all are SHIP under the federal government. And a lot of us now are navigating towards using just the SHIP and our state abbreviation so that everybody knows what we are, no matter what state and or territory that you go to. So what do? We provide information to the public regarding Medicare and other senior health insurance options and issues. We're here to provide objective counseling, assistance, and advocacy relating to Medicare. We also do Medicaid as it relates to Medicare, Medicare supplements, otherwise known as Medigap. We do the prescription drugs, otherwise known as Medicare Part D, if you've heard of that, and other health insurance related issues. And what we do is we conduct targeted outreach, which enables us to access counseling information to a greater number of beneficiaries. We have 10, our state is broken up into 10 regions. And in all of my regions of the state, I have a coordinator that is responsible for a number of counties for outreach, and not just outreach, but also to reach the beneficiaries in their area through one-on-one counseling. And now that we are in the world of Zoom and our GoToWebinars, we do that as well. So how did we come about? Well, in 1990, there was the creation of the federal and state health insurance program. In 91, there was a partnership between the South Carolina Commission on Aging, which is still us, we've had several name changes, and the South Carolina Department of Insurance. We had that partnership and we modeled our program after North Carolina's SHIP program. And as you see, their SHIP name has 2 I's in it. Well, we used their model, and then in 92, we established iCare, which was, at the beginning, when I started many, many years ago, it was just a temporary grant. So they didn't even know if the program was going to continue. And now it has been made a permanent part of the federal government's program and initiatives for Medicare beneficiaries. So why were we created? We were created because there are limited resources to obtain objective information. And as you know, Medicare is a complex coverage information. So there's a lot of things that can happen. There are no 2 situations alike. So this is one of the reasons why, one of the main reasons why the SHIP programs was created. And then we all know that unfortunately, there are people out here that sell products to Medicare beneficiaries and or their caregivers that participate in unfair selling practices. So we're here to help people navigate through those issues. So why do we have volunteers and counselors? We offer additional educational opportunities. You have people that retire, and even though they retire, they still are looking for something to do. So we have our counselors, we have people that volunteers. Counselors actually counsel individuals, help them get into plans, navigate through that Medicare maze. And then we have some volunteers that will go out and do our outreach with us. Those individuals come from different backgrounds and have different skill sets that can help us obtain our mission. The volunteers expand the agency's ability to market SHIP services. So we have them statewide. Currently, we have over 600 Medicare volunteers. Not all of them are active at this time, but over the course of the years, we've actually trained 600 people to become either counselors or volunteers. And then, as I mentioned, people, when they retire, they may not be ready to just stop altogether. This helps them fulfill a personal objective. They like to continue helping. We have many that are social workers or social worker backgrounds or other backgrounds that have that desire to continue to use the skills that they have. So what does counseling mean? Or volunteering, what does that mean? Volunteers receive the training to help beneficiaries improve their understanding of the Medicare and supplemental products that we have. Counselors and volunteers receive ongoing supervision to empower consumers to make healthcare choices. We provide not only do we have an online training session that people can go through at their leisure, which lasts for 5 weeks, and at the end, if they desire to be certified, they can become a certified counselor, and they will now be able to go out and counsel individuals about Medicare options. We also have a volunteer training program that we do that is through the different AAA offices that are around the state. AAA offices are the area agencies on aging that we contract with. They have volunteers that come through their agency and they volunteer with them. And then we also do an in-person training once a year through the various regions that desire to do it. It's 5 weeks long, and we partner with a whole host of other agencies, and I'll tell you about those shortly. So what are some requirements? This is what I bet. You have to have a commitment to learn and serve. Can't have a conflict of interest. So we can't accept licensed insurance agents, medical sales agents, unfortunately no attorneys as well. Not saying that they would do anything that they shouldn't, but it just serves as a conflict of interest on us. You can complete a registration form. When we have the in-person training, which we currently have one going on right here in Columbia, you must attend all the sessions, and if you wish to be a certified counselor, then you must receive or achieve an 80% proficiency on the final exam. And then you become certified and you're able to go out and counsel individuals under the SHIP program here in South Carolina. This just outlines what our SHIP training looks like. So if someone desires to come and do this, not only is it in person, as I mentioned, we do have an online track as well. And by you going through this, we timed it. It's about the same hours that you're going to get if you actually go through the online product. So we do orientation. We discuss Part A, Part B, Part C and D, all the 4 parts of Medicare. We also have a component about Medicaid and Medicaid fraud. We talk about Medicare supplements, otherwise known as Medigap products. SSA is also a partner with us. SSA is the Social Security Administration, and they talk about what they do as it relates to persons with Medicare. We also have our last track is the Medicare fraud. Medicare, Medicaid fraud are similar, but there are some different aspects to it as well. So we do all of that, and so at the end will have gone through about 20 and a half hours of credit that we can give you for attending these sessions, either in person and or online. So how do we do this? Not only do the people come in, we actually produce what we call a SHIP handbook. Through CMS, which is the Centers for Medicare and Medicaid Services, we get all of our information. So we put all of that information, all of that training that we get throughout the year into a handbook. And this real thick handbook serves as a resource for learning, a key resource for providing services. So you will go through that enormous or gigantic book throughout the training, those 5 weeks that you have it. And it also serves as a key resource for certification, because although I've been doing this for a number of years, as I was telling them earlier, no 2 situations are the same. And every now and then I forget something. So that book is wonderful to be able to go back through. We produce it every year, so as the information changes, we change out all the information, put in the new information, so that upcoming year, the persons that are doing training have the most up-to-date information. These are our key players. These are the people that help us do what we do here in the state of South Carolina. We, of course, are the Department on Aging. And as I mentioned, we have our 10 regions, and I have coordinators and counselors in all. The Department of Insurance, who we contract with, comes and helps us with our Medicare supplemental track. Social Security Administration plays a huge part in helping us get the word out about not only SHIP, but how to sign up for Medicare. They actually are a great referral service for us as well. We partner with the South Carolina Department of Health and Human Services, or HHS, and their Medicaid division. That is the actual Medicaid agency, but we have a specific area that we use or that we deal with that helps us get the word out about what Medicaid options are available for older persons and or disabled population that we deal with. And then we also contract or partner with, I should say, the South Carolina Attorney General's Medicaid Fraud Unit. And they come and give us information about what's going on in the Medicaid world and fraud. And what's not on here is the Medicare fraud, and that is myself. We actually have a component within our agency that we do and I handle for Medicare fraud, which I'll talk about in just a moment. Now, what do the area agencies on aging do? We are funded, meaning that South Carolina Department on Aging is funded from the federal government. The Administration for Community Living funds our program, federally funded. And then we fund the area agencies on aging to provide the Medicare counseling. Those are the 10 regions that I told you about. They provide the counseling, they do Part D or enrollment. Part D is the prescription drug plan. They do that Medicare Advantage plan enrollments, disenrollments. They supervise their volunteers for their region. So anyone who desires to be a volunteer based on the county that they live in, we turn them over to the area agency on aging in that county because they are the ones that are going to be supervising them. They are also responsible for volunteer recruitment. We are heavily on that. We really, really need volunteers, and if anybody desires to be one, then please get in contact with us and we'll get you to the correct person. They provide technical assistance to the people in their areas as well. And they are responsible for outreach presentations and assistance where needed. The Councils on Aging help provide counseling assistance as well. Those are the ones that fall under the area agencies on aging. So some of them provide counseling as well as the area agency on aging. And then you have us, the State Unit on Aging, or the South Carolina Department on Aging. The SHIP, we administer the SHIP program. We are responsible for training, and we're responsible for the facilitation and provision of Medicare related services. What are the volunteer roles? They're there for the Medicare beneficiaries. They're to help them with enrolling in Medicare, Medicaid, the supplement, as I mentioned, Medicare Advantage plans, otherwise known as Medicare Part C, and prescription drug plan. They're there to answer those questions. If they so desire, they're able to talk to small groups, attend follow-up training, and provide feedback or suggestions. We always want that to see how we're doing and how we may be able to enhance the program that we already have. Our targeted audience is Medicare beneficiaries, caregivers, retirees, medical and social service providers. Actually, anyone with Medicare questions, we are here to help you answer those. These are just some types of calls that we actually get about Medicare enrollment benefits, choosing a Medicare supplemental policy, whether or not they're eligible for Medicaid. We also review the Medicare summary notice. That's something that the beneficiaries get on a quarterly basis in order to know what Medicare has paid, the providers they've gone to, what they've charged, and what their financial responsibility may be. We also have them understanding Medicaid fraud, whether or not they have duplicate coverage, prescription assistance. We have a number of retirees that will call from various entities to find out whether or not their insurance is as good as Medicare, whether or not they need to change. We're there to answer all those. These are just a slight survey of what we get. We get a lot of different calls and for people from different information, excuse me. And then now we're seeing an influx of individuals from different states that are coming here as well. And so we will answer those questions as they're moving to our state to find out whether or not what they have is going to work here. And if not, trying to find something that is going to work in the state of South Carolina for what they need. How are we promoted? Through newspaper, radio ads, posters, networking, of course, health fairs. We have brochures and magnets. And I just mentioned earlier that we also now have a number of billboards, especially here around the Columbia area, in order for people to know who we are and actually what we do. Word of mouth is usually the best, but if we can get out and then people know that we exist, then I think we'll increase our traffic through our program as well. So we also provide update training. Not only do you go through that training initially for those 5 weeks to become a counselor and or volunteer, we provide update training 4 times a year, one being in the fall with a huge training where everybody comes to get all the information, and that's usually centered around open enrollment for Medicare prescription drug plan, so that everybody gets all of the information at one time. And we enable the counselors and volunteers to enroll or assist with what they call LIS, which is low income subsidy, or Medicare savings program, and those are programs to assist Medicare beneficiaries in paying for prescription drugs or paying for their Medicare Part B premium. So not only do they come 4 times a year, every day, usually I'm getting emails, so I'm sending updated emails, and we're also here to provide any technical assistance. So it's just not those 4 times a year, it's whenever someone needs update training or they need one-on-one counseling themselves as a counselor or volunteer. We are here at the state level, myself and my coordinator, to assist them through that process. One of the things that we do not, or not one of the things, but volunteers do not recommend insurance products. We don't make decisions for Medicare beneficiaries. We do not bash other Medicare products. Whether you like it or not, it's not our concern. The beneficiary is able to choose and decide what it is he or she wants to enroll in. You never betray a confidence, and you don't give advice. Those are our top rules. We are here to counsel the beneficiaries, give them all the tools that they need to make their informed decisions themselves. So why certify? To be certified, it's to provide accuracy, objectivity, and confidentiality. That's what our certification is all about. As I mentioned, people do not have to become certified if they do not want to. They do not have to take that exam, but if they take that exam, then I know once they've passed it, then they're able to go out and provide these services to Medicare recipients and make sure that we're all on the same page and the beneficiary is getting all the proper information that they need to make their informed decisions. All right, Senior Medicare Patrol. That's the other arm that we deal with within our agency or in my section, which is basically Medicare fraud. Our mission under the Senior Medicare Patrol is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. Not everybody is bad, and not everybody is dishonest. We just want to make sure that beneficiaries are aware of what's going on the outside and are not scammed, are not taken advantage of, so that they're able to maintain their benefits things that don't happen to their benefits that they don't want to or haven't had happen on their own. We conduct outreach and education through the SMP program. And because we are co-located, most of the time the SHIP program and the SMP program actually are in sync. So once you're talking about one part and you're given basic Medicare information, you usually tack on that SMP information or that Medicare fraud, just to make people aware. So we engage our volunteers as well. We want volunteers on all aspects. And then we receive beneficiary complaints. If a beneficiary has a complaint about a caller or someone that has come to their home unexpectedly, or they think they've been taken advantage of in any way, we're the ones that receive the complaints and are able to push them to the various entities to help them get it resolved. And I know I went through that pretty quickly, but this actually concludes my presentation about what SHIP is and what SMP is and how we can serve our Medicare beneficiaries and caregivers here in South Carolina. My information is up on the screen, my direct phone number and email address, and our 1-800 number, which you can provide to whomever you wish. And I'd like to thank everyone for having me. Susie, this concludes my presentation. Are there any questions?
Looking at the question, there are no questions. That was such good information. So I do invite our audience or anyone who is viewing this after the live presentation on our YouTube channel, definitely put any questions or comments in the comment area there on our YouTube channel, because this is so much good information. I'm sure that as soon as we're done, I'm going to have like 3 or 4 questions of my own. So that was really fascinating. I am so glad that the Department on Aging has this service, and that it's well funded for you guys. And I am sure that we will generate some interest from our audience today and down the road to maybe volunteer, because it's such important information for us to make sure that all the seniors out there know. And when we know someone, or we ourselves are getting to the Medicare age of 65, we're gonna potentially need some help navigating that, and now we know where to get it. So so that's awesome, really great information. I do have one question. How many, if you know right offhand, how many volunteers do you have around the state?
Last I looked, we had over 600, but they are not all active.
Wow.
So we've certified, I should say, 600, but we don't have that many active. A lot of them, unfortunately, I don't want to say fell off, but stopped volunteering, especially when COVID came. So now that we have a lot of people moving to our state, we've been getting a lot of different volunteers from other areas. So they've actually volunteered with the SHIP office in that state they came from, and now they are wanting to continue. And so we've gotten, actually in the last month, we've gotten 3.
That's great. That's a big number that you have certified. So, and like you said, maybe now that we're starting to emerge from the pandemic and everything, maybe some more folks will kind of get back in the swing of doing it. But I think it's a great program, and I love the training that you do. Seems really thorough, and so that's really hats off to you guys there at the department. So thank you, Crystal, for a great presentation. I thought it was really interesting, a lot of great information. We appreciate you providing your contact information so that any of our viewers, whether today live or on YouTube, have questions or want to access the program and maybe find a volunteer counselor in their area, they will be able to quickly get in touch with the program. So that's awesome. And thank you to our audience also for joining us here today and each week. Even if it's live or on our YouTube channel. So we welcome everyone and we appreciate you being here. And I want to remind you that if you did find this presentation helpful, and I know you did, and especially if you know it's going to be helpful to others, someone you know that may be reaching the Medicare age and things like that, or somebody who's maybe having difficulties with signing up for Medicare, please do go to our YouTube channel tomorrow at South Carolina Legal Services and share this broadcast out. We want as many people as possible to hear this important information that that Crystal has provided to us. And of course, while you're there, do like and subscribe for more. We really want everybody to do that and to sign up for those notifications so that you'll get that notification every week when we post a new episode on the YouTube channel. So, Crystal Strong, thanks so much for being with us today and providing this valuable information. And I want to tell our audience, be sure to tune in next week for another episode of Level Up Law on Tuesday at noon, where we will be, again, observing Older Americans Month. And Dale Watson from the South Carolina Department on Aging and Long-Term Care Ombudsman will be with us to explain to us what she does and how the Ombudsman can help our seniors here in South Carolina. So again, Crystal, thanks so much.
Thank you.
And I do want to remind the audience to sign up for live episodes of Level Up Law. You can go to the calendar on our website at sclegal.org. Or if you're on Facebook, you can find the link there each week on our Facebook account. We also post the registration link on our Twitter and Instagram accounts, so follow us there as well. Thanks for tuning in, everyone. That concludes today's webinar. Take care. See you next time.